On the 26th October 2024, the residential and commercial area, including banks and schools within the University College Hospital (UCH), were disconnected from the national grid by the Ibadan Electricity Distribution Company. For 100 days, the premier college hospital in Nigeria experienced total darkness, resulting to loss of lives. It took the intervention of the Minister of Power, Adebayo Adelabu, for power to be restored in the hospital. Following this development, the Newborn Essential Solution and Technologies 360 Alliance, which aimed to reduce newborn mortality in Nigeria, has donated essential newborn equipment, including incubators and solar inverter system, to the college hospital. The country director, NEST360, Dr. Okpeyemi Odedere, and the country and clinical lead, Professor Chinyere Eziaka, speak on the donations.
The intervention within the area of power, we've also ensured that we supplied equipment, medical equipment, for all facilities that we provide support to. These medical equipment are essential; they are needed, for the management of babies, for monitoring them, and for diagnostic purposes too as well. But again, apart from that as well, it's also in the area of capacity building, right? Because it's beyond just providing all this equipment. There, you need people. You need people to what? To ensure those equipment work. So there's capacity building, training of healthcare workers, training of nurses, training of doctors, and also training of biomedical engineers. All right, biomedical engineers are also involved. We need to train them so that they know how to maintain this equipment whenever this equipment develop faults. Yeah.
For the collaboration, they've been giving us all since our implementation in UCH since 2020. Thank you very much.
The Chief Medical Director of the University College Hospital, Professor Jesse Otegbayo, expressed gratitude to the management of NEST360 Alliance for the technology donated, while also speaking on the short, medium, and long-term impact of the technologies.
The productivity and the effectiveness of clinical service delivery to our newborns, especially those of them who are preterm or have one ailment or the other that requires care in a special unit. And we use a lot of equipment to take care of these babies, from suctioning machine, resuscitator that keeps them warm, the phototherapy machine that we use to remove excess bilirubin that can cause brain damage in them. If we have all this equipment and there's no power to power them, it will be of no effect. And we know today that in our hospital, the major headache that we have in terms of clinical service delivery is lack of power or inadequate power. So with this in place, 60 kVA is a lot, and it's going to help us to power all the gadgets that we use in the care of these babies. Therefore, the outcomes of care of all our patients will definitely improve.
The CMD says with the installation and commissioning of the solar inverters in the newborn section of the hospital, efforts are ongoing to make the college hospital independent of power grid.